between Leucoplakia and Candidiasis. So here is the video I am discussing, and this is the MCQ. Pause the video and try to answer. If you have thought the answer for this as Leucoplakia, yes, you are right. So this kind of MCQs, whenever you get, we should read the question very carefully and identify the positive clues and the negative clues. And if you look at this question, there are many positive clues and there are many negative clues which are given. So let us delve into the question, and in the next slide I will show each option and I will discuss why is that option not the answer and how can you rule out the other options. So first, if you'll read the question carefully, 30-year-old male truck driver. So this is very important clue. Why? Because the truck drivers, IV drug abusers, commercial sex workers, and male prostitutes, all of these individuals are going to have a higher chance for development of sexually transmitted disease. Okay, so that is why this is important clue. And comes for a routine examination for renewal of his commercial driver's license. So his problem is basically he needs a renewal of his license. The patient is asymptomatic, so he is not having any symptoms. Medical history is unremarkable, so he does not have any past history. He does not engage in a risky sexual behavior. So this is one very important negative point which is mentioned here. Though he is a truck driver, it is mentioned that he does not engage in any high risk sexual behavior. And there is also no any history of medications. And a recent HIV test was negative. So this is also a very important clue. Why is this important? I will tell you while discussing the options. He has a habit of chewing tobacco for 20 years, and this is by far the most important clue, positive clue, which has been mentioned in this question. Dentition is poor. Oral mucosal lesion is shown. Here you are able to see this mucosal lesion. There are no oral masses, there are no ulcers and no cervical lymphadenopathy. Okay, so that is also a very important issue. Yeah, this is the lesion which you are able to see. And this negative history is also very important. No oral masses, ulcers or cervical lymphadenopathy. Remainder of examination is normal. What is your diagnosis? So in the question, as you have seen, the HIV test is mentioned as negative. And why is this important? Because option D, which is oral hairy leukoplakia, which is caused by Epstein-Barr virus, it is very classically associated only with individuals who are affected by HIV. So with this negative history mentioned in the question, so we can safely rule out oral hairy leukoplakia. And if you look at option B, which option C, which is lichen planus, oral lichen planus is usually associated with dental fillings which have amalgam which consists of mercury. Nothing has been mentioned in the question like that, and also there is no mention of any lacy pattern which is observed in the oral mucosa, that is Wickham's is also not mentioned, nor any dental fillings is given, so we can safely rule out lichen planus. Whereas the first option, which is Candidiasis, so you may think that it is Candidiasis because if you see all the options actually can be very close differentials. Only history and examination and certain investigations are going to help us to rule out these conditions. Otherwise, clinically, if we see the patient, it is almost impossible for us to differentiate it. Okay, so in the Candidiasis, first of all, white membrane will be there, and very important point, this white membrane can be easily scraped off. This can be easily scraped off with the help of a spatula. But nothing is mentioned about this spatula. And not only this, we can perform a KOH, potassium hydroxide mount, on which we are going to see budding yeast cells. Budding yeast cells can be seen, and also pseudo hyphae can be seen. Pseudo hyphae. No mention has been made about this, so we can safely rule out this Candidiasis also. So we have ruled it out. So coming to the option B, leukoplakia. So this is basically a precancerous condition. This is a precancerous condition. This is a precancerous condition. That is, if it is left untreated in certain individuals, up to 1 to 20% of the individuals, this can turn out to become a malignancy. Okay, and this is usually associated with individuals who chew tobacco. Those who chew tobacco, that is, we call it as a smokeless tobacco. So if you look at the question, the clue which is mentioned is yes, this is the clue. He has habit of chewing tobacco for 20 years. This is a very important clue which is pointing out for the diagnosis of leukoplakia in this question. Okay, so in this fashion, we have to look at the question, we have to look at positive clues and also negative clues and try to rule out the options and most likely you will get to a final diagnosis in this fashion of ruling out of the options rather than directly jumping into the answer. Okay, please be very careful in this kind of questions. Why? Because these are very much doable if in case you read the question very carefully. Okay, and this is tomorrow's MCQ, and yes, if you know the answer for this question, leave your answer in the comment. I will check it out, and if your answer is right,